You hearing me now? Hello, test, 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 test.
Check 1, 2.
Check,
Can you
check,
hear me?
check. Tell me, you hear me now? Testing, testing. Tell me if you're hearing. Okay, yes. I don't know why you weren't hearing. I had the microphone plugged in and we used it last time. I don't know what happened this time, why it didn't work. We're saying, whoa, we look kind of tired, huh? Usually this little one is fast asleep by now, but I think I screwed up with the timing. Anyway, this is Dr. Reynolds, paging Dr. Dr. Ryan.
Iran.
Nerisi says she's Dr. Nerisi. Can you
Yes, she
imagine?
does.
Little Dr. Nerisi. She is a riot. But anyway, so 55 of you are on already. Wonderful. I was just waiting for 55 so we can get started. So this is,
Dr. Richard Reynolds,
and you are a,
orthopedic resident in training at the University Hospital of the West Indies.
okay, final year. So you've been like certified as a doctor how long? Like 15 years?
14.
14 years.
Yeah, 14.
Okay, so I listen to him when it comes to medical stuff specifically.
Only. Only.
Whatever. I follow his lead on all things medical. So we're listening to the radio, to the press conferences over the past couple of days. And as recently as this evening, there was a press conference by the Ministry of Health. And the question was asked, oh, in fact, you know Alvin Lynch?
Sounds very familiar.
The question was asked about wearing masks and what the recommendation is, and the response given asymptomatic. Let me just do the introduction and then I'll take you, okay, Ryan? Okay? So the response was that only if you're having symptoms, you should wear a mask. And Richie said that he disagrees with that strongly. He thinks everybody should wear masks. But just last week, he was telling me only if you have symptoms, you must wear masks. So I'm like, why you change your mind now all of a sudden? So I'll let him explain, and I'll take Ryan for a little bit. And you might hear me in the background asking questions.
Right, so essentially the COVID-19 virus is brand new, hence the name the novel coronavirus. And so information regarding the virus itself is changing and new information is coming out day by day. You hear things changing. There was once a recommendation to avoid NSAIDs. The next week there is a recommendation, oh, that's no longer so, they're safe. So things change very quickly where the novel coronavirus is concerned. Now, with regards to mask wear, it was initially thought that if you don't have symptoms, you are highly unlikely to be able to transmit the virus to someone else. New information, however, has surfaced primarily out of China, where this whole thing started, that persons have been able to transmit the virus even before they develop symptoms. And they found that there is a percentage of persons, up to 25% of persons, who are actually asymptomatic throughout the course of their disease, and they're simply asymptomatic carriers, kind of akin to typhoid Mary for all who are familiar with that story. Therefore,
I'm not familiar with that story. What is the typhoid Mary?
so during the typhoid outbreak, typhoid Mary was an asymptomatic carrier of the disease. So they treated typhoid by, first of all, identifying the persons who had it and having them essentially quarantined. Typhoid Mary had no symptoms, so she was able to pass on the disease to others without being identified as being infected, and that caused multiple persons to be infected by typhoid Mary.
That was
Hence
a
the
real
name.
person?
Yes, a
Like
real
Mary
person.
really was her name?
I'm not sure if Mary was really
Oh,
her
that's
name,
just
but
what they
that's
call-
what they called the
Okay.
person. So, the coronavirus has similar persons who are able to transmit the disease, who have the disease, without demonstrating any symptoms whatsoever. And as a result, you can't say, okay, only if you have symptoms you should wear a mask, because up to 50% of persons are able to transmit the disease to others without initially showing symptoms. And there's another set of persons who never show symptoms at all throughout their course, even though they have it and test positive for it. And so those people wouldn't be captured in the population of persons who are instructed to wear masks. The other thing about the coronavirus is that it seems to be highly infectious. Therefore, the droplets that are formed when someone coughs or sneezes or even speaks can cause transmission from one person to the next. The only country who seems to have gotten this virus under control, essentially eliminated it from their population, had no new cases recorded for any period of time, is China. Most of the information coming out of China is essentially going to be therefore world leading, because they were the first and they were the only country thus far to essentially control this condition. So when they looked at the population in China, they found that what worked for them was social distancing, education about frequent hand washing, avoiding touching your face, essentially respiratory hygiene, and mandatory mask wear for anyone going into a public space. So everybody had to wear a mask. And if you looked at images out of Wuhan in the latter course of the disease, you would realize that everybody was wearing a mask, children included. And so that is what worked for China. Now, a lot of people will say, but there is no evidence, medical evidence, to support the mass usage of masks. Truth is, that is in fact so. There is no solid evidence, because no study has really been done to say usage of masks decreases the spread of the virus, or any virus for that matter. Fact of the matter is that we're in a completely new situation. This virus has pretty much overtaken the entire world. And so whatever method it is that can possibly reduce the spread, then I think it's worth implementing those measures.
You know, the thing about China, the people in Wuhan wearing masks, Chinese people already used to wearing masks because of the high level of pollution.
The other thing
In
about
China.
China is that it's a communist state.
True.
And so the government has a lot more control over the coronavirus and the people in the areas that are affected. So they could essentially lock down a whole community, a whole district, and prevent others from entering, prevent people from leaving. They had intense temperature screening, and they removed people from their homes forcefully if they resisted, and took them to quarantine centers which they had developed. And so the fact that they had that much power in China also accelerated the control that they were able to get over the disease.
So we're not a communist state, obviously. What do you think the government should do? You think that they should strongly recommend mask wearing? What can they do?
So in terms of what they can do, one, public education. Public education is the most important thing where COVID-19 is concerned. People need to be aware of how it is spread. People need to be aware of the possible complications of the condition. People need to know why they need to stay home. You can't just tell people to stay home and not explain why. So that's the first thing. The same goes for mask wearing. People need to understand why it is that this can possibly make a difference, and a significant difference at that. And if you look at other countries that have implemented mask wearing, it seems to be making a difference. The Czech Republic, for example, their government has made it mandatory for anybody going into a public space to wear a mask. The problem with that is everybody thinks that you need surgical masks and that you need N95 masks in order to prevent this from happening. Truth is, you don't. Once you are covering your mouth and your nose so that you prevent the droplets from being expelled a certain distance, and you decrease the number of droplets that are released into the atmosphere and settle on surfaces, and you decrease the number of particles that are therefore the viral particles that are therefore in the atmosphere, you decrease the load and you decrease the likelihood of somebody else getting it. If an infected person therefore coughs with a mask on, less virus gets out. If a non-infected person is wearing a mask, whatever kind of mask it is, that mask decreases the chances of that person contracting the virus, because the virus then has to pass through a barrier in order to get into the respiratory tract of that person. Hence the reduction in the infection rates. And that is essentially what we're trying to do, decrease the rate of infection. And so in the Czech Republic, what they did was they mandated everybody to wear masks. These masks were actually simple homemade cloth masks. So
you don't need the fanciness, you can do it yourself.
You can in fact do it yourselves, and there are multiple videos on YouTube on how to construct homemade masks. The important thing is coverage. So you need to ensure that you're covering your nose and you're covering your mouth. Of course, it has to be made of a material that's breathable. You don't want to be able to breathe through the mask. You don't want to suffocate yourself under a mask that you made at home. And so what most people recommend is the use of cotton type fabric to make the mask, and using 3 layers in order to get sufficient barrier between yourself
Three layers
of fabric. Right.
All right, let's talk about some of the different type of masks, because we have 3 masks here. This one says, you can hold it up. This one says N95. I took a picture in that one last week. This one here also says N95. It looks completely different. And then we have this one.
So this is a regular surgical mask.
So first of all, tell us what the N95 mask is, why that's the one that's most recommended.
So again, it is not the most recommended mask.
It's not?
No,
but I
it
keep
is not.
hearing people say N95,
So
N95.
N95 masks are really the ones that offer you the most protection, but they do also have their challenges in that prolonged wear of an N95 mask makes it quite difficult to breathe. So it is a difficult mask for you to breathe in. For it to offer you proper protection as well, there's a fitting process that you have to go through in order to make sure that you're getting the appropriate protection from the mask. So N95 masks are actually all across the world limited to use by medical professionals, which is the other thing, that because of this scare, and understandably so, from the COVID-19 virus, the N95 masks have become exceedingly scarce, and that gets worse and worse as many people try and get as many of them as they possibly can to wear from day to day, to the point where these usually single-use disposable masks are now being reused by medical professionals.
Oh, so you're not supposed to use them more than once?
Correct. However, that guideline has actually been changed because of the COVID-19 pandemic and the effect that is having on the availability of these masks. So they've actually now developed a protocol for the reuse of these masks.
Oh, interesting.
But like I was saying before, the recommendations are fluid for COVID-19 prevention. And as time goes by, things change. My opinion in the beginning of this pandemic was that, well, these symptomatic people are the ones who are most likely to transmit the disease, and therefore they should be wearing the masks. However, now that information is out there that asymptomatic people can actually transmit the disease to others, then I think everybody should be wearing some kind of mask. Cloth masks, as is being used in the Czech Republic, are not as effective as these masks that we have here, the surgical masks and the N95 masks. But what it does, it decreases the load of virus that is emitted by persons during their day-to-day activities, whether just coughing, talking, sneezing, those kinds of activities. Cloth masks limits the number of particles, the size of the particles, and the viral load of the particles within the atmosphere after somebody with the virus then coughs or does something like that. It's the same principle behind simply covering your mouth when you cough. It's the same principle that is being applied. You want to limit the amount of particles that get propelled from out of your personal space.
So where did you get those masks from?
These masks were actually all ordered from China.
But I heard you were telling me earlier that there were some at Super Valley.
Yes, there are actually some at Super Value, but these in particular were from China.
Oh, okay. And they're not that expensive. They're pretty cheap.
Fairly.
You got them on Amazon?
Yes. The medical N95 masks are actually a bit more expensive, but as I said before, they're not necessary for public use. So the regular dust N95 masks that are used for construction and those kinds of jobs are actually quite effective as well, because I was also supposed to explain the meaning of N95. So N95 simply means that the mask filters out 95% of particles that are a certain size or larger. So the N95 simply means is a number that denotes that it filters out with 95% efficiency particles of a certain size. Those N95 masks are about 80-something% effective in prevention of transmission.
Okay, some other questions. So we have some questions.
Some questions here about blood type. So I did see where there was an association of blood type A with the more severe form of COVID-19. But
And all of us in this house have blood type A.
every last one.
All 5 of us.
But it was just that, an association. It was not clear evidence, and it hasn't been repeated anywhere else. My opinion on the matter is that there are multiple factors that determine whether or not you end up with a severe form of COVID-19. Age is definitely one. Comorbid illnesses has been said throughout the course, especially things that affect your immune system. So diabetes for sure, and use of certain medications such as steroids will also increase your chances of getting the severe form of the disease. It is unclear whether or not blood group A actually does have a similar effect.
All right, so how do we properly wear the mask?
So,
I saw you demonstrating to your parents the proper way to put it on and take it off and stuff.
right. So, the proper way to wear the mask. So, again, the important thing is coverage. So, whatever mask you're wearing needs to cover the bridge of the nose and go under the chin. That will ensure that your entire mouth and nose is covered. So, in applying the mask, you want to place the mask over your face, covering the bridge of your nose and under your chin. And then, if you have straps like this, which are, the function of them is to go around the ears, you place them around your ears, adjust the mask to ensure that it's under your chin, and then these masks come with a metal tubing at the top that is supposed to be pressed to conform to the shape of your nose, and that gives you a good fit. The N95 masks are applied slightly differently, and on most of the packaging you'll see how to properly apply it. So the mask should be held and the hand placed between the mask and the two straps. You cup the mask and then place it over your face. The top strap is then placed over first, and then the lower strap is placed over the top strap. The strap at the top goes towards the top of the head. The lower one goes to the base of the head. Again, you have the metal tubing at the top, which you use both hands to press down at the side to make sure that you have a good seal of the mask around the nose. You then should put your hands at the side of the mask and give a good exhale, a strong exhale, to make sure that no air is escaping around the side of the masks, to make sure you have a good seal. When you're removing it, you shouldn't remove the top one first, you remove it in reverse order. So the lower section comes off first, the upper section comes off next, and the important thing, when you take off the mask, you don't want to be touching the front of the mask because that's the most contaminated area.
But you just touch it.
Hopefully this house is not contaminated. So someone asking if the N95 is a one-time use. It should be, but like I said, because of the global shortage of the N95 masks, they are now reusing N95 masks all over the world, and they've developed protocol for the reuse of the N95 masks.
So what's the protocol?
So I'm not 100% sure what the protocol is, but from what I'm told, that the mask still shouldn't be worn for more than 4 hours consistently without it being removed from the face, because it absorbs moisture when you inhale and exhale. And once the mask becomes soaked, then the virus particles can actually travel through that soap mask and enter your respiratory tract.
Oh.
And so you still need to remove it after a certain period of time. Disinfect the front of the mask with alcohol, I believe, is what they're using. And leave it to dry, and then you can reuse.
Okay.
So someone asked about using cloth masks for protection. Now, the cloth masks, as I was saying before, do offer some amount of protection. The exact amount varies because you'll find that there is no standard for the manufacturing of cloth masks. And so the degree of protection varies. Now, the fact that the degree varies doesn't negate the fact that there is some amount of protection from wearing the masks. These cloth masks do offer some amount of protection. And at this point in time, any protection is better than nothing at all. And combined with social distancing and good respiratory hygiene, it can have a profound effect on the rate of spread of the disease. Now, our aim in Jamaica, I think, should be to contain the spread as much as is possible until a vaccine becomes widely available and persons can be vaccinated wholesale against this condition and essentially prevent further spread locally.
But I hear that vaccine is like months and months away.
So
like
typically it's
18
about
months.
18 months. We're already about 3 months into the search. The good thing about this vaccine is that it is advanced quickly because they quickly sequence the virus. So they already know what the genetic makeup of the virus is. So the production of a vaccine in terms of the chemical portions of it can go through a lot
But isn't
quicker.
the issue that they have to do extensive testing?
Right. So
And
the
that takes time.
testing part is another part that takes an extensive period of time. But if you are able to produce the drug quicker, then you get to the testing part quicker. And there have been already animal tests being done, and the next phase therefore is small human trials and then larger human trials. Someone asked what good respiratory hygiene entails. So firstly, you want to be washing your hands frequently. Typically, the mode of transmission of this virus is through droplets. Somebody sneezes, somebody coughs, these droplets are expelled, they fall onto surfaces, somebody else comes in, touches a door handle, touches a table, a desk, and then touches their face. So if you wash your hands frequently, you're much more likely to get rid of the virus on your hands, so that in the event that you do touch your face, you're not putting virus onto your face and near your respiratory tract where it then can enter.
And Rich is going to show us how to properly wash our hands. Can you believe he just showed me this today? Today. And I saw a video about how to properly wash your hands, but he says the video is incomplete. So he will show us the complete way of washing your hands. You guys ready to see his decontamination area? You finished with that point?
Not quite.
Okay.
So the other thing is to limit touching your face. So you don't want to be touching your eyes, your nose, your mouth, especially if your hands are not clean. So as far as it's possible, avoid touching your face. Now, this is a very difficult thing to do. It's hard because on a daily basis, everybody touches their face. And I'm sure, as I'm saying this now, somebody out there watching, your nose starting to itch and you want to scratch it so bad. It's something that you have to train yourself to avoid doing. And the more you practice doing it, is the better you will become at it. The other thing, of course, is in terms of prevention of spread. So respiratory hygiene goes two ways: preventing yourself from getting something and preventing yourself from spreading if you have it. So things like covering your mouth and your nose when you cough, in your elbow, not with your hands. Because if you cough or sneeze in your hands and you touch a surface, you touch something, then you're propagating spread of this condition. Somebody else comes, touches, and there we go. Which is why wearing a mask of any kind is always helpful. Because if you're in a mask and you cough or sneeze, the need to cover with your hands is no longer there. Cover still with your elbow, but that limits the amount of particles that will be spread by that cough or that sneeze. And so that in a nutshell is respiratory hygiene.
Finish the pot now.
Yes.
Come back just in time. All right, so Richie has this decontamination system outside on the porch. We took Larissa to the park yesterday or the day before.
Yesterday.
And he basically cleaned on the whole park before he would let her play on anything, the swings, the slide. He ended up ruining your shorts because you got bleach all over there. So let's show them outside the system that you have when you're coming inside from.
Sure, just to respond to a couple of questions though.
Okay.
Somebody asked about steroid use and if it is anabolic steroids that people take when they're exercising. So those tend not to affect your immune system as much as what the medication for multiple conditions, that is corticosteroids. So those are especially the ones, but anabolic steroids can have some effect on your immune system and may give a slight increase, but mostly it's the corticosteroids. So there was another question.
I said the surgical mask has gaps at the side though, so is it still effective?
So a properly applied surgical mask with the straps and not the ear loops, actually,
Like that one?
right?
The blue one
the
you have
blue
there?
one has the blue one we have here has ear loops. The straps are the ones that you tie around your head. So there are two straps, one that ties above your ears and one that ties below. That limits the gaps at the side. But if you think of it, that now creates gaps towards the sides of your face, where when you cough or sneeze, the majority of those particles tend to go forward. Anything coming out the side would be much less in terms of the volume and in terms of the size of the particles. And so it still offers you pretty good protection. So in terms of, somebody asks if I believe it's airborne. Well, they have in fact shown that the virus can be aerosolized, meaning it forms very small particles, what they call microparticles, that can be suspended in the air for long periods of time. However, because those particles are so small and because those particles are easily carried away, unless you're in an enclosed, cramped space with poor ventilation, that method of spread is not thought to be significant. But if you're in a poorly ventilated room with lots of people in it, then yes, airborne spread from aerosolized particles can occur.
Gary Lawrence asked, do you think Mr. Holness should stipulate that all public transportation passengers wear face masks?
So I think that it should stipulate that everybody going into a public space should wear a face mask of some kind.
As soon as you left your house,
As soon as you leave your house,
you should be wearing a mask.
you should be wearing a mask. Because if you do have the virus and if you're asymptomatic and you cough, you sneeze, if you shout, you produce droplets. And these droplets end up on surfaces that somebody else can touch. Somebody else can then touch their face, transmitted the virus. But if you have a mask on, it limits the number of particles that are getting out. It limits the load of the virus that's out there in the environment, and therefore limits the number of cases that will be transmitted.
Makes sense to me. I feel like it's a no-brainer. Paul Davis asks, we are told to sanitize hands often. Can we also inhale alcohol a few times to keep nostrils clean?
I wish. You find a lot of people sniffing alcohol, but no. The way alcohol works is that it actually dissolves the outer coating of the virus and destroys the virus. For that to happen, the concentration of alcohol has to be fairly high, and then it has to be left to dry. And that's why we recommend using alcohol containing hand sanitizers. So it dissolves the membrane during the drying process, and once it's dry, then you're sure that your hands are sanitized.
But it should be a certain percentage alcohol, right?
60 to 70%. That's what is recommended. But guess what? Soap and water works probably even better, because alcohol tends not to work if there are particles on your hands. If your hand is dirty, what happens is the virus ends up under those bits of dirt. The alcohol is absorbed by the particles of dirt, and the virus remains relatively protected from the alcohol. And so soap and water gets rid of the particles on your hand. The soap also dissolves the outer membrane of the virus, and therefore it also destroys the virus. Pretty much any soap can be used for this purpose. It doesn't even have to be antibacterial soap, because this is not a bacteria. It is in fact a virus.
Yeah. Oh, somebody says, I find it difficult to breathe with a mask.
That's one of the things with especially the N95 masks. If you've ever put one on, it's a task getting air in and out of your lungs. So wearing an N95 mask is difficult to do on a day-to-day basis for long periods of time. And that's why persons tend not to wear them for the entire duration when they're out and about. And two, the proper use of them is required for them to actually work well, and not many people are aware of the proper way to use them.
This is we can probably relate to this one. Natisha says, my 2-year-old refuses to keep anything on his face. What should single parents do if they have to take their children out to get supplies and that child won't keep mask in place? Whoa, that's a tough
Children
one.
are always tough to deal with in
Reese
times
is turning
like
2
these.
on Friday, so we know she probably put it off.
Always tough. And they had that very problem in China, because they were not sure whether or not children are asymptomatic carriers or if they just don't get the COVID-19 at all. What they end up saying is that it's likely that children tend to be carriers, and as a result, as a parent, the best thing you can do is to always keep your children's hands clean. You can try and keep a mask on them, but it would have to be, one, very breathable.
Yeah.
Because you don't want your children struggling to breathe at 2 years old under a mask. Very young ones, I wouldn't recommend putting masks on a newborn at all. Because
Just try to keep them inside.
exactly.
If you don't have
The
to
best
take them
thing
outside.
is to keep them inside, and that's why the other part of this whole stipulation of wearing masks for everybody is that it must go hand in hand with the other things: social distancing and also respiratory hygiene, so hand washing, not touching your face, covering your mouth when you sneeze, or sneezing into something like a handkerchief or a rag.
Can Lysol kill coronavirus? That's a good question.
So many cleaning agents can kill the coronavirus. So we spoke about soap, spoke about alcohol. Lysol is a powerful disinfectant, and if you look at it, all the Lysol bottle says 99.9% of germs, and germs in this case includes viruses. So the Lysol will do it, bleach will also do it, and when I show you the decontamination zone, you'll realize that I actually use bleach. It's a much cheaper alternative, but you have to be careful what you use it on, of course.
Yeah. All right, let's do that. We have a lot more questions, but let's do the decontamination zone and then the proper hand washing, and then we'll come back to your questions. So let's go outside to the decontamination zone, aka our porch. I'm gonna become, oh, here we go. Videographer now.
Wow, I get my own videographer.
Yes. Notice all clothes in the corner.
So because I actually work in a hospital setting where multiple patients come in, and like I said, people can be asymptomatic and have the coronavirus, in order to keep inside my house virus free, I've created this zone. So importantly, I ensure that I don't touch anything much out here until I have done a few things. So first thing I do, remove everything from my pocket. So my phone, wallet, car keys, everything. And then this is my solution of bleach. All of those, it's about a quarter cup of bleach to 4 cups of water.
Spray bottle.
This was Super Value. It's essentially a pesticide spray bottle that farmers use all the time. You can find it in pretty much any hardware store. Increase the pressure and then spray. Everything I listed before. So
the car keys,
phone, pens, wallet, cards, anything that's in my pocket. I adjust it to make sure it's a mist, and I just spray everything that's lined out essentially along here. Then,
that's why it was so hot. It's raining now.
For anything which may be a little bit more sensitive, that I don't want to spray bleach on, Lysol. After everything is taken out of my pockets, Lysol, bleach, then I remove outer clothing. So my shirt comes off, pants comes off, shoes come off.
So you strip outside?
Yes, I do.
You don't care if the neighbors see you?
Who cares if the neighbors see me?
Okay. Okay, we're back.
Then I spray my shoes and ensure that that's also well cleaned up. And then I sanitize my hands with my hand sanitizer, which actually has been sprayed with bleach as well. And then I open the door. So I don't touch the door until my hands are sanitized. Then, also I wear my mask to work. And the last thing I take off before I sanitize my hands is my mask. So I take off the mask, put it on top here, spray that as well, and then sanitize my hands. And then I go inside, head straight to the shower. Don't touch anything at all on my way to the shower. And head to toe scrub. And that's my decontamination plan.
Okay, so it's not that hard. So how do you get these clothes inside? Do you pick it up with something like a plastic or how?
That's exactly it. Put them in a plastic bag, put a plastic bag over them. I'll soon have one stationed out here.
Mm-hmm.
So I'll get a laundry basket lined with a plastic bag, put it out here.
All right. Let's demonstrate the proper hand washing technique now.
All right.
Can't
We'll
believe
need
you
some
just showed me that today.
soap and water.
Like, whoa, that's close. He's just showed me this proper hand washing technique this afternoon. After COVID been going on so long now. You're wrong for that, you know, babe.
I know.
I look tired. I don't feel as tired as I look though. It's just mommy stuff. Okay. Okay. I was having difficulty with the connection, but we're gonna go upstairs instead because the internet connection by this bathroom downstairs isn't very good. It's stronger up here, so we'll use this one. Turn on the lights in here, it's dark. Okay. All right, here we go. Messy bathroom, but who cares? You guys will learn. Okay.
So, most often we'll have to wash our hands in some kind of a public bathroom. Before you start washing your hands, get your hand drying agent. Supposed to be paper towel, but toilet paper will have to do right now. Put the pipe on, get your hands wet, then apply soap. And you're gonna lather up, rubbing your palms together.
This
Then
is really
interlace.
annoying me with this water stain on though.
The water has to stay on.
I know you're not supposed to touch back
Not
the
supposed to touch
pipe.
it at all.
Oh,
Then turn the back of your hand, wash. Interlace your fingers again. Then grab your thumb and use the other hand to grab the back of your hand and rotate around and around. This washes your thumb, which you missed while interlacing your fingers, as well as the back of your hands, which isn't usually well washed. Reverse to the opposite hand and do the same. Then you want to wash your nails. You do that by simply essentially scratching the palm of your hand. The other hand, and then you interlock your hands, move them side to side. You also want to wash the ends of your forearms and your wrist. So you grab your wrist and you rotate around and around. The other wrist, rotate, and then you rinse. This whole process should take you at least 20 seconds. If it's not taking you 20 seconds, you're not doing it right. Now, after you've rinsed, flash the excess water from your hands, then you dry. Ideally, the drying material should come from a no-touch self-dispensing machine. So you dry your hands and then you use the same implement that you use to dry your hands to turn the tap off.
use it.
Discard and you're done.
Okay. Well, we can use a towel since we're home, but
Yeah,
you're
in a
in
public
public.
space, it's best you use the paper towel, leave the tap running until you're through, dry your hands, and then use the paper towel, turn off the tap.
I had no idea hand washing was so complicated. Me either. Okay, Ryan, wake up. So, Richie, you text some more questions if you want to. Let's turn it on you. I'm gonna go deal with Ryan, and then you can sign out.
Yes, so hand washing can in fact be a complicated thing if you're not sure what exactly you're doing. But if you practice the right way all the time, it becomes second nature, and that's what you will do all the time. It becomes much easier. So, in terms of persons with bad sinuses, there are many persons like that out there. The bad sinusitis quite likely increases your likelihood of contracting the virus. Not sure what effect it has on developing severe symptoms. So you may just find that your sinuses become more inflamed than usual and you get a flare of your sinusitis. But also, it may make it easier for the virus to then progress and enter your lower respiratory tract where it causes the majority of the serious complications. Most people, though, still end up with mild symptoms, cough, sore throat, and some may even get shortness of breath. But if you have difficulty breathing, that's when it becomes a problem. So let me just see if we can get this tablet back on so I can see the questions, because on the phone the questions disappear after a couple of seconds. So I'm having difficulty keeping up with all of these questions. So generally speaking, somebody asked about how long a person that is asymptomatic essentially carries the disease. It's about, persons typically take about 2 weeks before they recover, and it should be pretty much the same time period that persons end up with the asymptomatic infection. So the asymptomatic carriers usually have it for about 2 weeks. The only way to know though for sure is to test, and it's really difficult to test everybody, because if you're going to test asymptomatic persons, it's really just going to mean that you're testing the entire population. So to go back over the COVID and the sinuses, so sinusitis, because your respiratory tract is inflamed with sinusitis, the virus finds it easier to attach to the inflamed lining of the sinuses, and as a result, it's quite likely that persons who are having bad sinusitis are more likely to contract the disease. Also, persons with bad sinusitis, they tend to have lots of drainage from their sinuses. They touch their face a lot quite often because of that constant irritation. Can COVID-19 go away on its own? What if somebody is asymptomatic? So yes, COVID-19 in the most part does go away on its own. It's a virus. We don't have currently any medication that specifically gets rid of viruses. What we do is we control the viruses until the body's immune system essentially clears it. So the body, generally speaking, does clear COVID-19 in the same way, right? So the patients who are asymptomatic, their immune system will clear the virus. Typically, it takes about 2 weeks. In terms of recommendations for sinuses, one, firstly, if your sinusitis is that bad, then you should probably seek the consult of an ENT specialist, ear, nose, and throat specialist. Those persons are, that's their area of specialty. That's what they do every day, and they would best be the ones to tailor a specific treatment program for your sinuses. Generally speaking, though, they there are fairly common medications used to treat sinuses. So there are oral medications as well as intranasal medications, which can be used to treat the sinusitis. And like I said, the best persons to advise on that would probably be an ENT surgeon. So, somebody said if we actually wash our hands like that, we won't have any water left to wash our hands next month. Truth is that properly washing your hands by that means does tend to waste a lot of water. And for the most part, the solution to that is to have either smart taps in public spaces where the water only comes on when you put your hands under the tap, or some form of foot pedal to control the water outlets. You press it with your foot, water comes on, you remove it, and it goes away. Just saw a question. Somebody asked earlier, how are they able to come up with a vaccine for COVID-19, but still there isn't an effective vaccine for the common flu virus? So I mentioned this before in the last live that we did. The common flu is not a single virus. The common flu is caused by multiple different viruses, and there is in fact a vaccine which is produced yearly based on trends. They try to predict the most likely viruses to cause a flu in an upcoming year, and they put all of those viruses together and give a vaccine for that particular season, but it doesn't cover all of the possible viruses that can cause the flu, because that would require a large amount of fluid to be injected, and most persons wouldn't appreciate that. So they have to keep the volume of the vaccine low, as well as they don't want to introduce so many different viruses to the immune system all at once. It can cause a hyperreaction of the immune system. So somebody asked about the virus and the lymphocytes. So there are different phases of the disease process, and what it tends to do in the end is cause a decrease in the number of lymphocytes that are present. Typically, in the initial phases, there is an increase of all your, and lymphocytes are basically the body's defense system, a part of the body's defense system, a group of cells called white blood cells. that help to fight infections, particularly viral infections. Um, and initially there is a large increase in those, but then I suspect because of an overwhelming initial response, the ability to produce more becomes decreased over time, and so there you end up with a decrease in the lymphocyte count. So, are there any more questions? With regards to fever, um, the fever is probably the most consistent symptom. About 85% of people with COVID-19 will end up with a fever. But that leaves about 15% of persons who won't have a fever, and about 80% of people will have a cough, which means that about 20% won't. So you're looking at possibly 15 to 20% of people will have no symptoms at all. And so that's still a significant number, considering that it is, if everybody in a population is exposed to it, then about 70 to 80% of the population will get it. Indeed, many things cause these same symptoms, and that's the difficulty in terms of treating the coronavirus, because it's difficult to differentiate the persons who have coronavirus from persons who have the common cold or influenza, the flu, or a bad sinus attack. The simple thing is that, one, if you have any such symptoms at all, wear a mask, stay at home, wash your hands, don't touch your face. If you start developing shortness of breath and difficulty breathing, then it's time for you to seek medical attention. That is something which needs to be closely monitored, and therefore you would need hospitalization likely, because things can progress pretty rapidly if in fact you do have the coronavirus. And sometimes even in the absence of these severe symptoms, your normal function of your lungs may be slightly altered. It's just that when you start getting these symptoms, the function of the lungs becomes less and less over time. So the lungs become less efficient over time because of the effects of the virus. So there are essentially two tests which are done here. Somebody asked about the testing process. There are two tests which are done here in Jamaica for the COVID-19 virus. One is a rapid test and one is a confirmatory test. The rapid test, of course, is not as accurate. So what is done is that they take a swab from your nostrils. So they have a container with a transport medium which keeps the virus alive, and there is a swab stick which is inserted into the nostrils all the way to the back of the nostrils, twirled around, pulled out, and stuck into this container. The container is then sealed and labeled appropriately and sent for the requisite testing. And like I said, there are two tests. There's a rapid test and there's a confirmatory test. The rapid test, because it is not as accurate, there are false positives as well as false negatives. So in some people who have the disease, it won't pick it up, and in some people who don't have the disease, it will say yes, you do. There were a couple of those in false positives in a batch that was tested here. I remember there was a report that 5 additional positive tests came in, but when the confirmatory tests came back, there were only 2 of those 5. So, or was it 3? 3 of those 5 were actually deemed to be positive by the confirmatory test, which involves looking for specific sequences in the DNA. Now, somebody asked earlier about the effects of temperature on the virus. So, on the rate of spread. And essentially, the information that we have about the virus states that it is not very heat stable, meaning that higher temperatures cause the virus to disintegrate, and therefore the hotter it is, the less likely it is for the virus to survive. Now, the temperature that was first thought to be the limit of survival for the virus was about 27 degrees Celsius for it to be out in the atmosphere and surviving. Typically, temperatures here in Jamaica and in most tropical climates are higher than that. Meaning, in warmer countries, the virus will not survive on surfaces as long as it would in colder countries. And that's, I think, is the reason for, even in the United States, if you look at the numbers and the severity of the areas that are most affected, the colder areas of the United States, so New York in particular, has a significant number of persons who are severely ill and dying because of COVID-19. But the warm areas, when you check Florida, for example, the number of deaths from COVID-19 is significantly lower, and the number of cases is also significantly lower. And so I think that definitely there is some effect of the environment on the ability of the virus to survive out in the open. Of course, if you're going to be in a room with AC and room temperature is 24 degrees, then that takes that out. In terms of smoking ganja as a possible treatment for COVID-19, let's just say that there's no medical evidence out there. The logics behind it, though, if you think about it, smoking negatively affects the lungs. COVID-19 negatively affects the lungs. Combination of those two things seems like a very bad combination. So it's more likely to cause worsening of your symptoms and likely to have you develop severe disease than it is to improve your symptoms. Alright, so if there are no more questions, thank you all for tuning in. And if there is anything that I feel strongly on again, I'll be sure to join you and give as much information as I can. Thank you all for tuning in.